Today I have on podcast with me Dr. Kyle Stanley from Beverly Hills, California. He graduated from University of Southern California and went on to do his residency in surgery and dental implants in Brazil. He is one of the few dental AI experts in the world. He has co founded a company called Pearl, which provides AI solutions in dentistry. He is also a researcher and an international speaker, and he's a prominent advocate of mental health in dentistry and has founded Light Side Academy to help dentists overcome their mental health challenges. So, let's ask him a few questions today. Hello, Dr. Kyle. Thank you so much for taking out time for us. Will you let's start with a small introduction.
So I did my dental school here in the US in California, and then I went to Brazil and did my implant specialty and surgery residency. So I was trained in dental implants and surgery and pros. And then I came back and I have a practice in Beverly Hills, and I teach a lot around the world. And I was going through a really difficult time in dentistry where I actually wanted to quit. And because I was speaking all over the place, I started talking about this experience that I had, hoping that it would resonate with other people. And it really did. It really took off. Everybody wanted me to talk more and more about mental health and less about clinical things. So I knew that this was a big topic. And that was what allowed me to start my Lightside Academy and build an online community of dentists that are focused on mastering their mental health. And it's really been very rewarding for me.
That's really impressive. So, Dr. Kyle, what affects clinicians mentally and physically on a daily basis, and what causes them to be at the risk of burnout?
Yeah, there's so many different factors. I think physically, that's really the easy part. You know, dentists, more than 90% of dentists have musculoskeletal pain. We're hunched over patients. We're working long hours. We're doing small, minute movements, so our muscles are strained for a long time. I think that's really the easy part. When you look at burnout, um, burnout is interesting because there's really three things that are associated with burnout, and that is exhaustion, feeling ineffective, and having cynicism towards what you're doing. And I think a lot of dentists have exhaustion, feel ineffective, and have cynicism. But the number one cause of chronic stress or of burnout is chronic stress. So there's things you have to look at, like our workload. Most of us take on a lot more cases than we can really handle. Our reward, how we feel we're rewarded for our job, whether that's financially or whether that's socially. The community that we have, I think many of us don't have a great community of practitioners around us, and that can definitely affect your mental health. There's just the aspect of dealing with excuse me, of dealing with people every day that are having problems and that don't want to be with you, don't want to pay, don't want to go through what you may have to do. I think it's just mentally challenging for people.
What do you think is the importance for taking time off for dental students as well as dental practitioners?
A very important topic. Only 10% of dentists take any time off, at least in the US, which is crazy. And we need to reset. I think most of us think if we just keep working, then all of our problems will go away. And what I found is that many dentists, when they take time off, they actually become more successful, which seems to be backwards. You'd think you take time off and you make less money and your patients aren't happy. But when you're rested and you come back, you can lead better. Your patients are more relaxed with you. You have a better vibe in the office. Everybody is kind of feeling good. And then patients are more likely to do treatment with you. They feel more comfortable, so then they're easier to work on. Your team is happier. So taking off time is so important. And what I've seen with the people that are in my community is that when they take time off, they become more successful. They end up making more money, which seems backwards.
Okay, so Dr. Kyle, do you think that good dentists are always rich and happy? And what is a measure of success in dentistry?
No, no, definitely not. There's a misconception that if you just get better clinically, then that's going to solve all your problems. And I'm here to tell you that that's not the case. We focus so much on our clinical skills and we forget to think about our relational skills and our mental skills. And that's really what makes you happy and successful is your relational skills and your mental skills. I think everybody knows a dentist who isn't that good clinically. However, they're successful financially. They are successful with their family, with their time, with their balance in life. So, of course, we need a minimum aspect of clinical skills. You can't be a terrible dentist, but you don't have to be a phenomenal dentist to have a great job, to have a great life, for your patients to be happy. Most of us focus so much on clinical dentistry and forget to learn and master other aspects of our life.
What do you think should be the priorities of a clinician and clinician as well as dental students?
Yeah, I think, in my group, we do something called dreams, which is diet, relationships, exercise, appreciation, meditation, and sleep. And you have to take care of yourself before you can take care of anybody else. So many times we focus everything on taking care of our patients, taking care of our team, taking care of our family. And you can't take care of them correctly unless you take care of yourself. So I think once you get your health in place, your diet, your relationships, meditating, things like this, that's when you can actually start focusing on getting better clinically, for example. You can't really do that unless you put yourself first. And if you're not in a great mental state, you're not going to do great dentistry. It's just not how it works.
Do you think male and female dentists go through the same problems, or one of them has it harder than the other? What is your opinion on this?
Definitely think that females have it harder around the world. And a lot of that is because they have very specific biological changes that us men don't go through. So I think the big struggle that most of my female colleagues deal with is balancing family and their job. They go to school for a long time, they spend a lot of money, a lot of time, a lot of effort to get there. And then they get out of school and they don't just want to start a family because they finally made it to be a dentist. Now they want to work, they want to set up their practice, they want to get some of the fruits of their labor finally. And many times what I see is that they put off having children, if they want children, of course. They put it off until there's a time that comes where they maybe can't have children. And then they go through a lot of shame and guilt and a very difficult time with thinking that maybe they prioritize things incorrectly during their childbearing years. And so I've had a lot of female colleagues that have told me the difficulties that they go through because of this balance, right? Us men don't have to think about that. We can have children whenever we want, right? And so that makes it more difficult. I've also seen that females have it harder in the workplace simply because they're women. So you have patients that will say like, oh, are you the doctor? Or when is the doctor coming in? Or are you the hygienist? Are you the assistant? There's still this stigma of, women not being doctors, which is so crazy after, 50, 60, 70 years of females being doctors. So I think that's another thing that they have it more difficult.
Um, There's this stereotype that women are at loss, especially when it comes to clinical skills in dentistry. Uh, can you share a few words? What is your opinion? Can women be just as competitive as men when it comes to clinical skills, especially? And can they be good dentists
Oh
with all
yeah,
the
I mean,
skills they
yeah, for sure. I mean, I have some female colleagues that are way better than some of the male colleagues that I know. I think it has nothing to do with gender, but more to do with effort and time and natural skill, hand skills. Um, there's some research to show that females see color better. So, for example, shade matching is usually better with females. I forget, they have more rods and cones in their eye or something like that. So, yeah, there's differences to men and women, and I think that women can be just as good, if not better, than male dentists.
Okay, that's great. Dr. Kyle, can you share a few techniques that a dentist can use to turn around their mental health if they are going through a burnout?
I think the main thing first is realizing you have a problem. In my course, the first step is called realize, and it's realizing that you have a problem. So, is your health different? Is your reactivity different? Are your emotions different? Is your income different? Like, start looking for changes that you have to first establish that you have a problem before you can figure out what to do with it. And the next thing that I say to do is identify all of your triggers. So go through and find out what really makes you angry or frustrated or sad about dentistry. Is it patients coming late? Is it patients telling you they hate the dentist? Is it living in an environment of fear every day? Is it the social pressure that you get from social media or friends? And you have to identify all of these triggers. The next step is to find your purpose in life and realize that it's not dentistry, that there's bigger things out there in the world that you're here to do. Dentistry is just your profession. And then you have to learn daily habits, daily success habits. Like I talked about, we say dreams, diet, relationships, exercise, appreciation, meditation, and sleep. And then the last bit is learning how to master your leadership and communication. So having good communication with patients, setting proper expectations is a very important one, and boundaries. So defining when you're going to be a dentist and when you're not going to be a dentist. When you're at home, you shouldn't be a dentist anymore. You're at home. You should be with your family or, your dog or whoever it is. But when you're in the practice, you should be a dentist and you shouldn't be thinking about your family at all. You should really have to live where your feet are.
Well, I would love to ask you about other aspects of your profession. You are the Chief Clinical Officer for Pearl, which is an AI tech company for dentistry. And we can quickly go through it right now, or would you like to talk about it some other time?
We can talk a little bit about it now if you want.
Yes, sure. So, how can dentists take advantage of AI and improve their practice with it?
Oh, I think that AI will eventually filter its way into every aspect of dentistry. It's already coming into different areas of our life outside of dentistry, right? In our cars, in our phones, in our cameras. It's all over the place. But what dentists are missing is that most of us have a lot of data in our practices that we're not doing anything with. So we have CBCTs, we have x-rays, we have chart notes, we have photographs, we have periodontal charting, but none of it really allows us to learn and get better. And that's what AI is here to do. It's here to take all of that data that is too much data for our simple human brains and make it useful. And so like what Pearl's doing is analyzing radiographs in real time to give feedback on what's seen clinically. So caries, bone loss, periapical radiolucency, calculus, a ton of other different detections. And I think this will help doctors with their mental health. It'll make sure they're not missing anything. It'll also build trust with the patients, which I think is super important. So I'm excited about artificial intelligence in dentistry. I think it's going to help a lot of people.
Okay, let's talk a little about implantology. Do you have any advice for young dentists who are aspiring for implantology?
Yeah, I think with implantology, we just need to be realistic with ourselves. We need to not accept all of the dogmas that have been shown to us in the last 20 years and really go into the research and understand that implant dentistry is different than traditional dentistry. You know, things that work on teeth don't work on implants. Things that work on implants don't work on teeth. And that's where I see a lot of the biggest problems is people think I'm going to do whatever works on teeth on implants. And implants they're a medical device. They're not a part of your body. And we need to think about them differently.
Okay, great. Dr. Kyle, would you like to give any advice for recent graduates or dental students?
Yeah, I would say to find your balance, find your purpose in life, and realize that dentistry is a part of your life. It's not who you are. And you really need to master your mental and relational health if you really want sustainable success in your career. A lot of dentists can have success in their career, but it's not sustainable because they're working too much, they're working too hard, they're only focusing on their clinical abilities. But if you really want to have sustainable success and do this for 20, 30, 40 years, you have to master your mental and relational health. It has to be a priority for you.
Thank you so much, Dr. Kyle, for this lovely talk. I'd like to ask you, how can students or dentists from Pakistan get in touch with you?
One of the easiest ways on Instagram, it's just Dr. Kyle Stanley, Dr. Kyle Stanley, or you can go to my website, drkylestanley.com. Or if you're interested in what I do with mental health, you can go to lightsidedentistry.com.
Thank you so much, Dr. Kyle, for taking out time for me. I'd love to make another podcast with you and talk a little bit more about your specialty.
Good. Let's set up another time.
Thank you. Thank you so much.